Okay, let's talk about something huge. Worldwide, get this, over 500 million people are estimated to live with some kind of joint disorder.
500 million.
Yeah.
That number is just staggering when you stop to think about it.
Isn't it? I mean, that's more than the entire population of North and South America combined. And it's often this sort of silent thing affecting how people move, enjoy their
Got
day.
their quality of life, really.
Exactly. You know that feeling, maybe after sitting too long, that stiffness in your knee, or just a little twinge?
That little signal your body sends.
Right. And what if that's not just random, but maybe an early sign, something actually quite manageable? We're going to unpack some really powerful strategies today.
And that starting point, that huge statistic, it really sets the stage. It's not just abstract numbers. It's a massive global mobility challenge.
Absolutely. And that feeling of stiffness, that twinge, it's so relatable, isn't it? It connects instantly.
It really does. It's something almost everyone experiences at some point.
And speaking of learning more and taking action, we really want to give a big thank you to London Heartbeat's Z Academy in the UK.
You're here.
They've been great with educational support. And honestly, they have this incredible range, over 150 courses. So if you're looking to, deepen your understanding in health areas, definitely check them out.
Yeah, they're a fantastic resource.
You can find them easily. Just search London Heartbeat Z Academy on Facebook, Instagram, YouTube. Subscribe, you'll get free updates, and you won't miss out on future discussions like this one.
And highlighting resources like that is so key, isn't it? Empowering people with knowledge is the first step towards managing their own health effectively.
Totally agree. So today, we're doing a deep dive into one specific condition that affects a huge chunk of those people. Knee osteoarthritis. Knee OA.
Very common.
We'll look at what it actually is, what's happening inside the knee, maybe why it happens, and crucially, how physiotherapy can be such a game changer.
Right. We've got some really good information lined up, aiming for a clear, practical view.
The focus on knee OA makes so much sense because it is so prevalent. When we say it's the most common joint disorder globally, well, that just underlines how many lives it touches.
Exactly. And why getting clear, actionable info out there is so vital.
So let's get right to the heart of it. What is knee osteoarthritis? What's actually going on in there?
Okay, so imagine your knee joint. It's like this really well-engineered hinge, right? The ends of the bones, your thigh bone, your shin bone, the kneecap, they're all covered in this smooth, kind of slippery tissue. That's cartilage.
The cushiony bit.
Exactly, the cushion. It lets the bones glide really smoothly when you move. Now, in knee OA, that cartilage starts to wear away, gradually over time.
Ah, okay. Like the non-stick coating on a pan that you've used for years.
That's a pretty good analogy, yeah? It gets thinner, maybe a bit rougher. It's not providing that smooth glide anymore.
So it's not usually like a big sudden injury, but more this slow wearing down process.
Precisely. Osteoarthritis is what we call a degenerative process. It develops and often worsens over time.
Right.
Now, a past injury can increase your risk or maybe speed things up, but often it's the cumulative effect of just, well, daily life, mechanical stress, other factors that leads to that cartilage breakdown.
The shock absorber just isn't absorbing like it used to.
You got it. It's losing its effectiveness.
Okay, so as that cushioning, that shock absorber wears down, what are the signs? What symptoms might someone notice?
Well, the most common one, often the first thing people really notice is pain, knee pain.
Okay.
And what's characteristic is that this pain usually gets worse when you use the knee more. So things like walking, stairs, up or down, even just standing for a while can really flare it up.
Right, like the knee is saying, hey, ease up a bit.
Pretty much, yeah. It's a pain linked to activity.
Okay, so pain with activity. What else?
Stiffness is another really common one, especially, first thing in the morning or maybe after you've been sitting for a long stretch.
Ah, that getting going stiffness.
Exactly. It can feel really hard to bend or straighten the knee properly like it needs, like it needs oiling, basically.
Yeah, I think many people can relate to that feeling, even without OA. And you mentioned swelling, too.
Yes. Swelling around the knee joint itself is another frequent sign. It's often down to inflammation in the joint.
The body reacting to the damage.
The body's response. So the knee might look puffy or feel tight, a bit swollen.
Okay, so just to recap the main flags. Knee pain that kicks up with activity, stiffness especially after resting, and some swelling. That paints a clear picture of the daily experience.
It does. Those are the hallmarks.
Now let's pivot to solutions, or management, really. Our sources really hammer home the role of physiotherapy. What makes physio so central here?
Well, physiotherapy offers this really comprehensive and tailored approach. It's not just about masking the symptoms. It's
Mhm.
about tackling the underlying mechanics, the muscle function, and crucially, empowering the person to manage their condition. Think of it like having a coach for your knee.
A knee coach. I like that. So what are the main pillars of this physiotherapy coaching for knee OA? What do they focus on?
Okay, number one, almost always is exercise, but not just any exercise.
Specific stuff.
Very specific. Exercises designed to strengthen the muscles around the knee joint, your quadriceps, hamstrings. These are the knee's dynamic support system.
Ah, the muscles that help control it.
Exactly. By making them stronger, they can take some of the load off the joint itself, absorb more shock, provide better stability. It's like building stronger supports around a slightly worn structure.
Makes perfect sense. Building up that muscle scaffolding. What's another key area?
Education is huge,
Mm.
especially around lifestyle modifications. And the sources specifically mention weight loss.
Right, the impact of weight.
Yeah. Extra body weight puts a lot of extra pressure on those knee joints. It can accelerate the cartilage wear and definitely makes the pain worse.
So the physio helps with guidance on that too.
Absolutely. Providing advice, support, strategies for managing weight safely and effectively, it can make a massive difference. It's like literally taking a heavy backpack off the joint.
Okay, exercise and weight management through education. Got it. What about more hands-on stuff?
Manual therapy, that's another key component. This is where the physio uses their hands.
Okay.
They might do gentle joint mobilizations, sort of specific movements to help improve the knee's range of motion, reduce that stiffness we talked about.
Ah, getting it moving better.
Yeah. And also maybe soft tissue techniques like massage for the muscles around the knee if they're tight or sore. So it's like fine-tuning the mechanics.
So it's not just exercises you do alone, there's that direct treatment too. And electrotherapy was mentioned. What's that about?
Electrotherapy modalities, things like ultrasound or more commonly TNS, that's transcutaneous electrical nerve stimulation.
TNS. Yeah, I've heard of that.
It can be used as additional tools, often for pain management or maybe reducing some inflammation.
Mm-hmm.
TNS, for instance, uses little electrical pulses that can kind of scramble the pain signals going to your brain.
So temporary relief.
Often, yes. Temporary relief that can make it easier for someone to then engage in their exercises, which is the really crucial part long term. Electrotherapy is usually an adjunct used alongside the exercise in manual therapy.
Okay, so we've got this mix. Strengthening exercises, lifestyle education focusing on weight, hands-on manual therapy, and maybe some electrotherapy tools.
Yeah.
What's the big picture goal? What are we aiming for with all this?
The main aims really are twofold. Significantly reduce the pain the person is experiencing
Makes sense.
and improve the overall function of that knee joint, make it work better.
Right.
So by tackling the muscle weakness, the stiffness, the pain, physiotherapy helps people move more comfortably, do more of their daily activities, and just have a better quality of life.
It's about getting back to living more fully.
Exactly, regaining that mobility and independence.
That's a really positive outlook. Now, just for a bit of context, the sources mention these core physio ideas, exercise, manual therapy, education. They pop up elsewhere too, right? For other issues.
They absolutely do. While knee OA is our focus, these fundamental principles are incredibly versatile in physiotherapy.
Like what? Give us an example.
Okay, take something like a frozen shoulder. Very different joint, obviously.
Right, super stiff and painful shoulder.
Yeah. Physio there often involves specific, gentle exercises to gradually regain range of motion, plus manual techniques to work on the tight capsule around the joint. Different area, same core ideas. Restore movement, reduce pain through targeted intervention.
Okay. What about patellofemoral pain, that kneecap pain some people get?
Right, often seen in younger people sometimes. With that, physio often digs into the why, the biomechanics. Are there muscle imbalances, maybe around the hip or knee?
Ah, looking at the whole chain.
Exactly. Strengthening certain quad muscles, like the VMO, is often key to help the kneecap track better. So again, it's addressing muscle function through exercise tailored to that specific problem.
And even for something systemic like rheumatoid arthritis.
Even there, yeah. RA is autoimmune, lots of inflammation. Physio has to be careful, especially during flare-ups.
Hmm.
But the goals are often similar. Pain relief, trying to maintain joint mobility and strength to prevent deformities, and keeping function up. The approach might be gentler, but the core aims persist.
And quickly, something acute, like an ankle sprain.
Ankle sprain, classic physio territory. Initially, it's about controlling the pain and swelling. Then, as it heals,
Getting the movement back.
exactly, gradually restoring range of motion, then strengthening the muscles around the ankle to stabilize it, and, crucially, reduce the risk of it happening again. So pain, function, prevention, same themes.
It's really fascinating how those building blocks apply so widely. But okay, let's zoom back in on knee OA specifically. We know the overall goals are less pain, better function. Can we get a little bit more specific about the physio targets for knee OA?
Absolutely. So a primary goal, as we said, is reducing that pain and any inflammation going on of the joint.
Calming things down.
Precisely. And all those tools we discussed, the right exercises, the hands-on manual therapy, maybe electrotherapy, they all work towards that, easing the irritation.
And beyond just pain relief, what else are we aiming for?
Improving the range of motion is really important. That stiffness really gets in the way of daily life, bending down, chairs, walking smoothly.
Yeah, absolutely.
So specific stretches, mobilizations, aiming to get that knee bending and straightening more fully, more easily. And alongside that, boosting strength.
Right, the muscle support again.
Crucial. Stronger quads, stronger hamstrings mean better control, better shock absorption, less strain on the actual joint surfaces. So strength gains are a huge target.
Okay, so less pain, more flexibility, stronger support.
Right.
Makes sense. But what about the person's own role? It can't just be passive treatment, right?
Oh, absolutely not. And that's where patient education is so vital. It's a cornerstone, really.
Empowering them.
Exactly. Helping people truly understand their knees OA, what's happening, why certain things help, how they can manage it day to day. This includes advice on managing pain flare-ups at home, maybe modifying activities.
Knowing when to push and when to ease off.
Precisely. And critically, understanding why sticking with their exercise program is so important for the long haul. It's about making them an active partner in their care.
That self-management piece seems key for a chronic condition. And the sources mention tailored home exercise programs.
Yes, that's fundamental. A good physio plan will always include an individualized home exercise program.
Not just a generic sheet of exercises.
No, definitely not. It should be tailored to their specific needs, their current ability. Usually a mix of exercises for strength, flexibility, maybe balance too.
And doing them regularly is the trick.
Consistency is everything. That home program is their toolkit for managing the condition long term.
Got it. So it's equipping people for the day-to-day. Just to cover all bases, what else might be in that physio toolkit for knee OA? Any other modalities?
Well, we've covered the main ones: exercise, education, manual therapy, electrotherapy. But sometimes knee braces can be helpful for certain people.
For extra support.
Yeah, to provide some external support, maybe unload the joint a bit during specific activities.
Yeah.
It's not for everyone, but it's an option.
Okay.
And another one, especially if land-based exercise is just too painful initially, is hydrotherapy.
Exercising in water.
Exactly. Exercising in a warm pool. The buoyancy of the water takes a lot of the weight off the joints, making movement easier and less painful for some people.
Yeah.
It can be a great way to start building strength and mobility.
So lots of different tools the physio can draw on depending on the person.
Definitely. It's a very adaptable approach.
Okay, so let's try and wrap this up. Knee osteoarthritis. Super common, caused by that cartilage wearing down in the knee. Leads to the classic symptoms: pain, stiffness, swelling. But physiotherapy offers this really comprehensive, multi-pronged attack, doesn't it?
It really does.
Focusing on strengthening those crucial supporting muscles, educating people about managing their weight and activity levels, using hands-on manual therapy, sometimes things like electrotherapy.
Right.
And the big goals are always dialing down that pain and getting the knee working better, improving overall function and mobility.
That sums it up perfectly. And I think the key takeaway is that while, yes, knee OA is chronic, it's long-term.
Yeah.
Physiotherapy gives people real, effective strategies to manage it actively, to maintain their quality of life, stay as active as they can. It offers hope and practical tools.
That's a great point. It's not about a cure, but about effective management and living well despite the condition.
Exactly.
This has been incredibly useful, really shedding light on something so widespread. Which brings me to a final thought for you listening right now. Given how common knee OA is, and knowing now how much physiotherapy can potentially help, maybe think about this. What proactive steps could you take? Starting today, maybe for yourself, maybe for someone you know dealing with knee issues. What can you do to prioritize your joint health, your mobility, long-term?
It's a really important question to consider.
Definitely something to mull over. Thank you so much for joining us for this deep dive today.